Do you have creaky or stiff knees when bending or going up the stairs? I'm Dr. Justin Lin, physical therapist at Rehab and Revive. Watch how we get rid of this next. To tackle this problem, we're going to focus on mobilizing your kneecaps. This is because by design, this joint with its anatomical grooves improves proper joint lubrication and creates natural sliding and gliding within the joint. We're just facilitating it externally with our hands to regain the sufficient feel. All right, everyone, I've got a little knee model here, and essentially I want you to think about what the kneecap does and these grooves. So we got these little grooves here, and they sit like this. I like to think of it like a glacier kind of going right through and carving the mountainside back in the prehistoric days as the ice age was melting. But in a perfect world, you should be able to kind of it should just slide and glide. And it should relatively stay in the track of sliding and guiding. So our knee is no different. And I'm going to use my operated side here. In a perfect world, if I straighten the knee, it's going up. And if I am going to bend my knee, it needs to kind of like secure and basically protect the insides, like your meniscus and your other tissues, your cartilage, and your soft tissues, your fat pad. So what I tell people in this particular case, I kind of angle myself here, is if you're going to mobilize this, you need to check it all different angles. So you need to check it. Does it go down? And I kind of like it at this leg angle first, because it's kind of like relaxed but not fully straight, and it's not fully bent where everything's tight and all your fascia and your connective tissues are tight. So what you want to do is you want to be able to go up and down. Up and down. It should just move nice and easy. It shouldn't pop out or move to the side. It's just go really just translation. That should be nice. Now, you should also be able to go left and right, just like to a degree. There should be a little bit of give, but you don't want it to pop out. That's otherwise you're dislocating it. Remember that mountainside analogy of the glacier. And this one, usually it can go that way a little bit more than it does go that way, just because of how our bones are. And that's what it is that's going to give you knee stability. Now, your exercise in particular, I've had exercise knee traction where I basically tell you to pull it and open it up and do the knee bending. But this one in particular is just use the heel of your hand, and you're going in the same plane as your shin. What you're going to do is you're going to just put pressure down here, right? And easily you can try different angles, but you can just work on pumping it up and down. Now, what this is going to do, what we want, the reason we're doing knee mobilization in general and knee tracking, like I said, just make everything smooth, make everything glide freely, be able to hinge at our knee joint here, because this is actually like the fulcrum of a pulley. We have a really popular video about is kneecap important? Yeah, it basically helps smooth out that little fulcrum area instead of just being a hinge only. So we're going to do this. I can try at different angles. I can try with ankle motions. The next thing is really important is you want to take your fingers and you want to pull it up. So this should be going up, and there we go, right? So you want to pull it upwards. Upwards. You want to create as much, if there's distance, you can go this way too. You're basically trying to get everything mobile. So I can tell you, for me, up is a little bit more stiff, going back. So you could try different angles. If it's stiff, you go with that action. And then you can kind of see how this all plays out. Now, rarely am I pushing it to the side, but in some instances I am. So you can use the heel of your hand. I'm going that way, heel of your hand. That doesn't feel stiff to me. That doesn't feel stiff to me when it straightens. This feels a little stiff to me when it bends, so I might do that, and that's fine. So, I could probably push it at an angle and downward angle a little bit and get that movement. And so all that popping, snapping should improve ideally, because you're getting that natural lubrication. You're just trying at different angles, straightening, bending, pumping your ankle, and then just makes that knee tracking a lot better. That's it. Let us know your thoughts on our video and leave us some love or questions in the comments box below. Please like and subscribe. We appreciate your support. I'm Dr. Lin. Remember, we heal smarter.